For patients with type 2 diabetes, clinical guidelines recommend reducing elevated blood pressure to lower the risk of cardiovascular disease. However, the effective targets for systolic blood pressure reduction in patients with diabetes are unclear. A new trial examined cardiovascular outcomes with intensive blood pressure control as compared with standard control in these patients. This parallel design multicenter randomized trial conducted in China included nearly 13,000 adults 50 years of age or older with type 2 diabetes, elevated systolic blood pressure, and an increased risk of cardiovascular disease. Participants were assigned either to intensive antihypertensive treatment, which targeted a systolic blood pressure of less than 120 millimeters of mercury, or to standard treatment, which targeted a systolic blood pressure of less than 140 millimeters of mercury, for up to 5 years. The primary outcome was a composite of the first occurrence of non-fatal stroke, non-fatal myocardial infarction, treatment or hospitalization for heart failure, or death from cardiovascular causes. During a median follow-up of approximately 4 years, the incidence of the composite primary outcome was significantly lower with intensive treatment, at 1.65 events per 100 person years, as compared with standard treatment at 2.09 events per 100 person years. Approximately 1/3 of the participants in each group experienced serious adverse events. However, symptomatic hypotension occurred more often with intensive treatment than with standard treatment. The incidence of hyperkalemia was higher in the intensive group as well. The authors conclude that in patients with type 2 diabetes, elevated systolic blood pressure, and an increased risk of cardiovascular disease, the incidence of major cardiovascular events was significantly lower with intensive antihypertensive treatment than with standard treatment over approximately 4 years of follow-up. Full trial results are available at NEJM.org.